Hi, my name's Cameron McIntosh. I'm an ENT surgeon and a board-certified facial plastic surgeon. So a rhinoplasty is a very complicated surgical procedure to improve both the function and the cosmetic harmony of a patient's nose on their face. It's really, really important that both parts are addressed. You need to address a person's nasal breathing and their function in terms of how well do they breathe, and also you need to address various factors in terms of how their face and their nose are in harmony with each other. You've got to be really careful about having a rhinoplasty. You don't just go ahead and have a rhinoplasty. You need to think quite carefully about who do you want to operate on you. And a couple of things I would highly recommend is make sure you've done some research on your surgeon. Are they a member of one of the international societies? Are they a member of the South African Rhinoplasty Society? Do they do this as a hobby, or is this their passion that they're doing every single day? What are their results looking like? Are they capable of not just doing the cosmetic side, but also the functional side of the procedure? When we cosmetically improve a patient's nose, there are lots and lots of different things we can do. When I walk into theatre, I generally only want to do 3 things. The important thing to understand is if you change one thing, it has a major effect on another part of the nose. So you may change the rotation in the tip, and that may look as if the hump is less or the hump is more. So by simplifying and only having 3 cosmetic goals in each case, it means that you can get a far better result than going in and expecting to have 20 different cosmetic goals. So the 5 most common cosmetic things that I can do with the nose is firstly is changing the nasal profile, so be that taking a bump away. The second one is to change the rotation of the nasal tip by lifting that up or lowering it. The third thing is to change the shape of the nostrils. The fourth thing is to narrow the nose. That may be narrowing the bones or narrowing the tip. And finally, we would look to straighten the nose to get it absolutely perfect for your face. So how do you go about actually having a rhinoplasty? There are 2 ways. Either you need to come and see me in the rooms, and I will do a full history examination, possibly special procedures. From there, we decide, will your medical aid cover, depending on how bad the functional aspect is? Do you even have any cosmetic requests? We will then go ahead, we probably have to write a motivation to your medical aid, and then we'll go ahead and book your surgery. However, many patients cannot come in and see me, and then we start the process by filling in forms online and submitting your photographs and your payments. I then, within 24 to 48 hours, will have time to review it, and I will be in contact with you to set up a live Skype meeting. Once we've been able to see what exactly is wrong with your nose, we go to the next process, and that is to book your surgery. For my international patients, I have surgeries on Wednesdays and Thursdays. You would fly into South Africa and come and see me the day before your operation. I would operate on you, and then most likely you'd be going back to your hotel that night. I would like to see you after 6 days to remove all your sutures and packing, and from there you're free to go. In terms of South African patients who have to fly in, they may well need funding from their medical insurance, and that then will be the same process as if you have come to see me in the rooms directly. I would also require to follow up with you 6 days after the surgery. However, if you do have a referring doctor who sent you to me, they are welcome to remove all bandages and sutures after 6 days.